We're going to move into the final session this morning. Jacob Abela is going to talk to us about the role of exercise and physiotherapy in the management of diabetes and metabolic syndrome. So Jacob's an accredited exercise physiologist and founder of the Kinetics Health Group. He has a keen interest in the management of diabetes and metabolic syndrome. And as I mentioned earlier, it's not just about using treatments to control glucose and weight, but there's also definitely a role for exercise and diet. So we'll be interested to hear what Jacob's got to say about exercise. Thanks.
Thanks guys, I'll just get it set up real quick. Thanks for the introduction, and it's a pleasure to be here today. So I do appreciate the invitation to present, and like you guys said, I'm going to be presenting on the role of exercise physiology and how we are incorporated in the management of diabetes and metabolic syndrome. I know we're running a little bit behind, so probably won't go through everything in too much depth, but that's just a quick breakdown of what we're going to do, but I'll skip that and get straight into it. Basically, all exercise physiologists are university qualified, so we do actually have to do a 4-year minimum degree, and we provide a more active approach to the treatment process. So we're less hands-on, like you say, comparatively to physiotherapy. We're less hands-on, we're more active-based, either in the gym or lifestyle modification through exercise programs designed specifically to the needs and the considerations for each patient. Through understanding the pathology and the exercise-related contraindications to diabetes and metabolic syndrome, we were able to elicit certain changes that are favoured upon in diabetes, and in that particular case, we're looking at blood sugar reduction, medication dosage lowering, and potentially removal if we have really good clients who listen to what we say. Weight loss, muscle building, and resensitization to insulin are our main goals in that. So I thought I'd quickly run through the preventative measures with exercise. Basically, I think it's like 61% of adults with type 2 diabetes are not currently engaging in any form of exercise, and being that that's a precursor to, I should say, physical inactivity is a precursor to development and onset of type 2 diabetes. I think it's really good to point out those statistics. But basically, enhancing your blood glucose control through acute glucose disposal, muscle-mediated increases in glucose and glycogen usage, maintaining insulin sensitivity, and lowering the risk of all the associated comorbidities is how exercise would help in the prevention of type 2 diabetes. And the regular or the current recommendation for 30 minutes a day or 2.5 hours per week of exercise is still the current recommendation for non-diagnosed patients. So jumping into the acute training effects, and in particular here, aerobic training. A single session of aerobic exercise will increase insulin activity as well as glucose tolerance for 24 to 48 hours post-exercise. So that's a heightened response that I think is really important in the day-to-day management of diabetes. It also decreases the blood glucose levels, and different studies show different responses, but it can be up to 10 millimoles per litre reduction. I think in that one was a 16-week course of exercise. Those reductions were seen early on, but then maintained throughout the 16-week program. And decreases in plasma insulin levels as well. There's not really too high of a risk of exercise-induced hypoglycemia unless they're on insulin or insulin secretagogues, in which case we would speak to them prior to commencing exercise and educate them on how and when to take some carbohydrates or some glucose prior to coming in. Resistance training has similar effects. Basically, the fasting blood glucose levels will be lower for 24 hours post-exercise. So due to an increase in muscle metabolism of the glucose, along with increased metabolic rates and things like that, what you see is a decrease in the fasting blood glucose for the next day and sometimes the following day as well. Amongst all the research that we base our programs on, they all state that a combined approach is more effective for blood glucose management than either aerobic or resistance training alone. Okay, chronic effects. So these numbers here, the 46.3, 7.1, 12 to 15%, they're specific to certain research articles. Obviously it may vary in that, but insulin sensitivity is probably the biggest one. Reduction in fasting blood glucose levels, reduction in HbA1c, these are all common effects of chronic exercise programming in patients with type 2 diabetes, and are obviously quite favourable in
That's
that.
1.2%, isn't it, to 1.5? That's what it should read. Sorry to interrupt. Yeah.
Yeah? Okay. Yeah, okay. That's fine. Where are we? Oh yeah, so, sorry? No, you're right. No, it's just that was just off a research article. Yeah, 10 to 11% fat reduction was in one article as well. But basically, we're just looking at reducing weight, which will help with other things spoken before about fatty liver and things like that. Just to be able to get away from those comorbidities and other complications. Medication I spoke about before is one of the big things that we look to try and reduce where we can. Obviously we don't make those recommendations, but as a patient is taking their medication and engaging in exercise as well, basically their sugars will start to drop, and then we would obviously instruct them to go back to see their GP and review the way they're managing that to maybe be able to lower the dosages periodically until we get to a stage where the GP is happy to maybe look at lifestyle treatment. And HbA1c as well. So basically, we want to be able to keep it below 7%, just to be able to avoid the complications moving forward from there. So in terms of the recommendations, this is based specifically on type 2 diabetes. And 3 days a week for aerobic exercise is what is recommended, with no more than 2 consecutive rest days. The reason that is we want to be able to capitalise on the acute effects for the exercise, and they typically last 24 to 48 hours. So we want to be able to do an exercise session on a Monday, have the prolonged effect on the Tuesday, and then jump into some more exercise on a Wednesday to be able to have that acute effect roll on. Working at an intensity of 5 to 7 out of 10 is what we usually try to get our patients to be mindful of. We don't obviously want to push them too hard, but we want to be able to have them working within a range that's eliciting the changes that we want without having to create any other complications. 50 minutes is plenty for aerobic exercise if you're doing it on its own. If you're coupling it with resistance training, then 30 to 40 minutes is plenty, and in our case we use 30 minutes. Resistance training, so twice per week at a minimum, 3 days is ideal, and not on consecutive days. So we want to give your muscles time to rest and repair following exercise, and that usually takes 24 to 48 hours as well. So working at a 50 to 60% 1 rep max range, and that basically is 1 rep max is basically how much weight you can lift for 1 repetition, and that's essentially your strength. And then we work at a 50 to 60% of that to determine how heavy the patient should be lifting, and so on. Duration, exercises, repetitions, and sets: 5 to 10, 10 to 15, and 2 to 4. We basically just do 6 exercises for 10 repetitions and 3 sets. So 3 sets of 10 is the easiest way for people to think. We don't want to try and make things too complicated by saying do this exercise 12 times, do this exercise 10 times. Just make it easy, and you'll have better adoption moving forward. What we specifically do for our diabetic patients, we run a program called Diabetics. Basically, following a referral from the GP, they would come in to see us. We would conduct an initial assessment where we do a comprehensive health and musculoskeletal injury screen. We also check vitals and observations as well. So basically, we run blood pressure, heart rate monitoring. We do a single lead ECG screen using this really cool portable single lead ECG screen, and basically what it does is it just
5 minutes.
It just utilises your mobile phone and the piece of equipment to basically screen for the 4 major arrhythmias, and then we can flag that if we need to and send a copy of the ECG with them back to the GP to get followed up. Following the screen, we identify and stratify the issues and basically use that in the development of their exercise program. We'll also engage in patient education for blood sugar level control, monitoring and timing of glucose and carbohydrate intake if needed, and again that comes down to how high their sugars are or whether they're on insulin or secretagogues. We give a food, water and sleep diary so that we're able to monitor what they're eating, what they're drinking, and then see where we're going wrong if we're not getting the desired results that we need to, and more often than not we find that lying in their food diary. We then take them through a one-on-one introduction appointment where we basically take them through the actual program that they're going to complete within our group program, and then get them familiarised with the specific pieces of equipment and how it all works. Following that, they'll jump into the actual group class, which runs for 60 minutes, and we do that twice a week. It's supervised by an accredited exercise physiologist, and we take a combined approach of aerobic and resistance training. We stagger it in our design so that we have consistently elevated heart rate over the course of the session, and what I mean by that is that they'll usually start with some cardio exercise. They might jump on the treadmill for 10 minutes. Heart rate will slowly start to rise through that time. Then we get them to do a couple of resistance training exercises. It'll slowly start to drop. Then we'll get them onto maybe the bike. It'll come back up. It'll drop with some more exercise. And so we're just able to keep that heart rate elevated over the hour rather than doing a block of 30 minutes of cardio at the start and then a block of resistance training at the end. We find that it helps the patients to get through the program easier, and there's less resistance to adopting an exercise program. Getting your patients involved. So I'm assuming all you guys know about the EPC. It's the most common one, and it is the most common way that we receive referrals for patients with type 2 diabetes. The thing to point out with the referring is that obviously with this there's referrals for physio in there, dietitian, diabetes educator, podiatry. So you may want a patient who needs some foot care to go to podiatry. Or they may have already used their sessions through the year for physio for some injury rehab, and that's where the next referral comes in, and that's the one that we tend to find is not as widely adopted, and maybe that's because there's a little bit of confusion around it, but basically it's a completely separate referral to the CDM referral, the EPC referral. It's only for patients with type 2 diabetes, and it can be used for exercise physiology and dietitian for group services. Okay, now that gives the patient an initial assessment and 8 supervised group classes. So in our case, we obviously do exercise-based group classes. That one requires a GP management plan or a review, but it doesn't require team care arrangements. Unless, of course, you want to couple it with a CDM plan, then in that case you would need to do team care arrangements as well. Billing is the same, so you guys would bill the same as you would for a GPMP, you would for the type 2 diabetes group referral. And just to give you a bit of a look at what it looks like, that's what the referral looks like there. Many of you will have seen it already, but
2 minutes.
It's a really good way to be able to really give that referral off to exercise in a case where patients would have already used their 5 EPC sessions throughout the year. So yeah, look, that's me done, guys. I appreciate the time, and thanks for having me. Cheers.